Hi, this is Stan Goff. I'm with Dental Products Report, and today I have Debbie Seidel-Bittke, and she is the founder and the CEO of Dental Practice Solutions. She is also a hygiene productivity coach. Hi, Debbie.
Hi, Stan. Thanks for joining me. What a difference this life is joining you
Yes,
today.
these are crazy times for the whole world, certainly for the dental industry, and certainly for hygienists. So that's why we wanted to speak with you today, and I wanted to give you a chance to talk a little bit about your company and the coaching and the helping you do for hygienists, and then the whole COVID-19 pandemic and how it affects the industry, hygienists, and what we can do going forward here.
Well, thank you. I am in the dental field for many decades, and for the last 20 years, I have been the founder and CEO of Dental Practice Solutions. And 20 years ago, I started out because I was a dental hygienist and I had a lot of knowledge. I worked in academia at the University of Southern California, and I wanted to get paid more than $80 a day, which is what I made as an assistant professor at the university. So, I set my sights and started speaking at all the dental conferences all over the United States and Canada from like the first year it all happened. And then I've been able to help offices throughout the world to optimize their hygiene department. And that's by taking a team approach. Like I integrate the entire team to boost productivity in the hygiene department. So I have processes and systems around that function and that outcome. Now, most recently, doctors are coming to me because they had to change, not cancel, but they changed their appointments for their patients during COVID-19. So I've created a formula to get those patients back on your hygiene schedule. And it's a super hygiene day formula. And it does not mean that hygienists are doing accelerated hygiene. That's not what I'm talking about. But I have a formula that can capture lost revenue during the COVID-19. So I took an old formula for hygiene schedules, but I actually recalculated that and re-engineer it for each individual practice.
And I'm sure, obviously, during these times, that's huge. We've got some practices that have been able to open recently for more than just emergency care, but many are hoping to do so shortly. But in the last 6, 7, 8 weeks, there have been a lot of hygiene patients that haven't been able to go see their doctor and their hygienist.
Yes. So when we first look at those numbers, about 6 weeks into this, I had an office, we looked at their numbers, and there were about 524 hygiene patients that needed to be rescheduled. But then we need to understand, like, not all those patients are coming back for one appointment. And you want to be able to have your hygienist also see new patients. So how do we recap that lost revenue so we can still make up for it? I believe with this strategy, doctors can make up for the lost revenue over the last 2 months. So, yeah.
And you wrote an article for us recently about teamwork. During this whole, teamwork is huge all the time. But as we try to get the industry and the practices back on board and the hygiene departments, I imagine just communication between the departments and the teamwork is just going to be so critical.
It is so critical. And what I've discovered is the doctors and this is an ADA survey that said most doctors kind of threw their hands up the first month and said, I'm just not going to meet my 2020 goals. I know it's not going to happen. And I'm not ready to say that doctors should wave the white flag and surrender that. I do believe that with the right strategy, it can happen. And that right strategy means communication and collaboration. No one person has all the answers for you, but if you can have an expert, like I've just been doing free webinar series every week for 8 weeks now. And then I've been doing some low cost trainings to help these doctors to customize what's best for them. All I have is a brain with a lot of knowledge. And if I can see what's happening in the doctor's practice, the two of us can brainstorm to recap that lost revenue. We can recoup that. There is still time to do that. And what does that look like? It's different from each practice because each doctor has a different vision. But never do you want to just go garden or spend time every day during these 8 weeks with your kids. You have to take time to meet with your team. You have to take time with your team members to give them hope, to let them know what's going on. Now's the time where communication there's never too much communication at this point in time. Like, let your team know what you're doing. And on top of that, your team and you, doctor, need to be telling your patients, what are you doing different? Like, I was looking personally for a new dentist because I did not know what my dentist was doing differently. Now, I'm friends with him on social media. So the other day I saw what he's doing to capture the aerosols. I felt a little more comfortable.
Yep.
But before I go in, I do want to ask them to tell me, what are they doing differently? We all want to be safe.
Yep. Now, and obviously, communication is huge, and also, like you said, there's been a lot of downtime, but that doesn't mean nothing can be accomplished. I mean, there's a lot of important things that dentists and team members should have been doing these last few weeks, and can be doing, and should still be doing, and communicating with patients is one of them.
Yes. So right now there are some offices that will be opening up. I know that in Illinois, I've been talking to doctors, ironically, in Illinois quite a bit for some reason. Illinois and California are the ones reaching out to me right now. And they told me that one doctor said May 30th she's able to open. Another doctor in Illinois thought it was more like June 8th that she would open up. And I was telling the doctors that right now you need to be using your patient engagement software. I'm talking about, the Solution Reach, the Revenue Well, and these type of things where you can two-way message your patients. And you need to know, like right now, you already needed to know, how do your patients want to be contacted?
Yeah.
So definitely, at the very least, send an email of what's happening. And like, I really love some of these patient engagement softwares, and I've been working behind the scenes with them to create COVID-19, what we're doing differently. These templates of newsletters are available to the doctors if they're using some of these patient engagement systems. So utilize those. And now's the time to definitely have those in place and text message your patient. Like I'm really into video and teaching my clients how to do video messages. Many times doctors aren't comfortable with that, but I get them to be comfortable. We write out some scripts, and I don't want you reading from a script, but write out what you're going to say ahead of time. Patients love video from you, especially. It doesn't have to be doctor. A lot of doctors just are too timid to do it, but it could be the hygienist. And, if you're everybody's on social media. Like, one doctor asked me, should I be posting every week on Facebook? I said, yes, you should be posting every day. And she said, really? I go, yeah, Monday through Friday, something. Let them know what you're doing.
I think it's
even
critical.
If it's something fun.
Let the patients know, number one, you're still there for emergencies and you're still there to communicate with them. And then number two, I think, like, even for your own personal case, if you're preparing to go back to the dentist soon, you want to know what they're doing to make you feel a little safer, a little more comfortable.
Exactly. And that's where the masses are on Facebook. And then I'm seeing more and more dentists. And I mean, for years, younger people, if you have a younger population, they're on Instagram. I see a lot of dental offices on Instagram now too. So people are there.
Especially during these times where you can't meet face to face, you just have to get those messages out there.
Yeah, super important. I don't see enough of it being done.
Now, you may have touched on some of the topics already covered in it, but I know recently you had an online course called Hygiene Department Recovery. Anything you want to go a little deeper into that?
So what we were doing is it's like I reverse engineer everything. So day 3, we're actually working with that formula. I tell you the formula and the numbers that you can pull up from your reports. But I believe that when the patients come in, there are things you need to do differently. And what are those various assessments? So we're talking about that on day 1. And I just finished, oddly enough, before this call, I had an opportunity with a doctor, and we took a look at her numbers. And that's something that I've been offering doctors, just look under the hood. And so we were able to discover some really great things. Because I can talk to the doctor and say, when was your last day that you worked? So she told me the last day. And I was able to look at her KPIs, her production, hygiene department in particular, and right away I could tell her some things that were going on. And I'm telling you, like, just from today, talking with her for about 30 minutes, she got so much. I mean, seriously, she's going to make at least another $10,000 just by something I told her, because I looked under the hood. And it was only in 30 minutes. Like, those are the kind of things that I know if I can look under the hood. So now she had gone through the course, and she knows what needs to be done when they come in. But we could see that those things weren't done before, and there were some other things attached to those services that I saw weren't happening. So that's day one, is what are you going to do? Day two is all about value. Like, what does your patient value? And I have some secret tips on subliminal ways to get your patients to tell you what they value. You don't even have to ask them, what do you value, Mr. Patient? So that's day two. And then day three is the actual formula, putting it all together.
So this sounds like a pretty nice program that could work all the time, not just recovering from a crazy COVID-19 pandemic, but it just sounds like as we do get hopefully back to where everyone's open and running soon, there needs hope and some programs and some plans to give a little confidence to the patients as well as the practices.
I mean, Stan, it's so exciting for me right now. And I mean, this is like, I've taken money off the table right now. I just love helping dentists. I mean, in 30 minutes, I know for sure there's one thing that will bring her at least no less than $10,000. Just
so you're a good person to talk to for a while.
Yeah, I mean, it's just, if doctors will reach out to an expert, it's like if my husband and I, no, we're not having a bad marriage or anything, but if we were having a marital problem, we would go to a marriage coach. Like for my taxes, I go to a specific CPA. My husband no longer does our taxes because I want to get the best advice. And so, my message is, again, communication, like, you can't do it alone. You don't need to do it alone. You do not need to wave the white flag. Like, there are people who have knowledge to get you where you planned on being.
And now just the hygienists, it's a tough job these days when there are concerns about their health. And some practices are opening now, some soon. Some hygienists are in states that maybe have already opened, and they're not sure their doctor or their practice is doing enough to make them feel good. What advice do you give to them, and how do these practices make sure they have the right PPE and the right protocol and new screening methods? And
yes. I mean, it's a really good question, and I'm really happy. I'm every day on Tuesday and Wednesdays every week, I have a session 12:15 to 12:45 Pacific, and it's on our website. So it's a free webinar series. So like, we're having an OSHA series on Wednesday. We have embezzlement, because I know there's a lot of embezzlement going on right now, by the way. That's on Tuesday. And then we've got some other special speakers. But in that webinar series, at the end, we take a little break and I come back. And what I do is I talk to anybody who's having fear. And I want to know why. What is it that you're fearful about? And why do you feel that way? Now, I'll tell you right now, the number one reason is like 90% of the people are saying they just don't know what their doctor is going to do differently. Yeah. And these are the majority of people who are freaking out because the doctor hasn't been communicating. So there's a doctor in my area. I'm in a suburb of Portland, and there's another dentist who's in the suburb of Portland, about 30 minutes from me. Now, she broadcasts all over Portland, and who knows where else saw it. My husband saw her website and something about her office on LinkedIn. Imagine that. It showed up on his LinkedIn, not mine. He's not a dental professional, but he saw it and shared it with me. And she's telling the whole entire world exactly what she's doing differently. So when I saw that, and then I saw, my dentist wasn't doing anything, I was thinking, oh my gosh, I want to go to her, Yeah. So I started using her as an example when I was doing my webinars, when I was doing my trainings, like, look at what this lady is doing. Now, I called the office, and everybody is coming back to work there because she actually has some system that is supposed to, I believe it's FDA approved, to kill 99.9% of the viruses and aerosols in the air. So there are certain systems that are going to help prevent the aerosols from us breathing in. I don't know much about an N95 mask. And I read over the weekend on Facebook, so it must be true, right? That, I guess we have to do our own respirator test with the N95.
Yeah,
I don't know, but I am going to wear a higher filtration mask, not the level one that I was wearing. And I'm looking for a shield where I can wear my loops and light.
that's
So
the
I do
tricky part,
practice.
the shield and the loops. Yeah.
I do practice one day a month usually. And I'd like to still do that. I really love caring for patients. And it also gives me the ability to say that to the hygienist I'm working with, I do walk your talk. I understand exactly where you're at because I put myself in their shoes all the time. But I think that we can't be, like, we have to be safe, and we have to be, like, we have to use our critical thinking skills. We can't just go back to the way we were doing things. We have to do things differently, but don't be driven by fear. Like, don't let fear remove because when you're fearful, when you fear, like these hygienists were texting me and emailing, and they were like, one of the hygienists texted me back and said, "I'm so sorry. I didn't mean to be so rude to you in that text message, but I just want you to understand I'm so scared." And I said, "Please tell me more." And it's just that their doctor doesn't want to talk with them right now. Not until they go back does that doctor want to talk to them. And that is where the fear is coming. It's the unknown. And when we get fearful, like if your patient comes in and they're afraid to have a dentist look in their mouth, or a hygienist, they're afraid to sit in the dental chair, they're in fight or flight mode. And that's exactly what's happening with these dental professionals. You can't think straight. So just know, like, I just got off a private phone call with a friend of mine in Portland, and she was telling me about a situation. She's not a dental professional, but she was so into this fight or flight mode. And I was telling her, it's because it's not, she goes, "I went into PSD." I go, "But I want you to know that it's not just what happened in your past. There are so many people, like, we all have our own fears. We all are just dealing with it differently."
Yeah, this is a crazy time where stress and anxiety are all too common. Everyone's dealing with it in some way, and the whole uncertainty of it all. I think on the plus side for the dental industry is that cleanliness, infection control has been huge in dental offices for years. I mean, you go back 20 years, they weren't wearing gloves all the time and stuff like that. So the practices have been very clean and very I see great regimens, but now they're just like you said. I think communicating the fact that there are newer steps to battle this latest COVID-19 pandemic, and so not only are the hygienists wanting to be informed of that, I guess the patients need to know about it as well, just for their confidence.
Absolutely, yeah. And we do, technology today does allow us numerous way to keep in contact with our patients very easily. It's cost effective for the doctors.
So the communication is key, and then and some of the newer methods that you're hearing more about are extraoral HEPA vacuum systems in a practice that will suck all that bad germy air out of there and away from the patient's mouth before the staff deals with it and filters that out of the practice. There are also talks about procedural rinses. I always have a tricky time with that word, but these are methods, newer methods to make cleanliness and infection control even better than it's been in the past. And I imagine what's good about that is you're learning of these new companies working together and scientists and trying to get make things even better.
Right. The thing is, like with the pre-procedure rinse, I mean, I know 20 years ago, chlorhexidine was the standard of care, but we've had some situations that people had adverse reactions to the chlorhexidine, so it's no longer the gold standard. But I don't know the efficacy of a pre-procedural rinse. I'd have to look at the FDA guidelines and the OSHA, the form that comes with it. Like, how long does that last? Because we're constantly disrupting saliva in the mouth, and the new saliva, is it able to work for more than 2 minutes or more than 20 minutes? Because we're constantly producing new saliva as our mouth is being worked on. So I don't understand that. But what I do understand is, for many years for 20 years I've been laser certified, and I do love laser. Now, laser kills bacteria. That's why we like it. It reduces inflammation. So I know that some of these laser companies are now creating a device that can actually take the aerosol. And I just love laser because it's killing bacteria. So I'm thinking that when you put the power of their new system to reduce the aerosols and you've got laser, you've got like a win-win-win-win-win, because the patient's inflammation is being reduced. The disease is, we're putting a halt to the disease and the bad bugs, and we're going to kill those aerosols. So I do love this option of the laser, because I just think anybody with inflammation, I mean, laser is the best option. I actually don't have gum disease. I don't think I have gingivitis right now, although I'm overdue, because I take really good care of my teeth being a dental professional. I'm obsessed over it. But, you know, I just have had some back pain. And as a hygienist, we do have these occupational hazards that happen. So I went to my chiropractor and he did a laser over, he just waved it over my back. And Stan, oh my gosh, I could tell night and day. I mean, it was like not even 10 minutes of holding the laser over this, you know, not touching my skin, but he just waved it over. It was definitely a magic wand, and it was taking down the inflammation. And I left that chiropractor appointment feeling so much better. And it makes me feel so great to know, look what I'm doing to my patients to reduce the inflammation when I use laser. So I think laser company is going to do really well with this.
Good. Now we're talking about some of these newer methods and newer protocols, but if you go back to some of the very common everyday procedures for hygienists, they might change a little bit in the interim here in terms of polishing and ultrasonic scalers, some of those treatments and some of those procedures that maybe are a little heavy on the aerosols just because of the way of the way they function.
Yeah, so I saw a picture of a doctor. It almost looked like this huge tube, and I know she was doing safe amalgam removal. And there was this tube that you would hold up, and that's how they did the safe amalgam removal. And I think some doctors are using that. But I know I was talking with Patterson Dental in particular, because they had contacted me, and they have some access to something that's not as scary looking. And one thing I really liked and discovered about 20 years ago, a new company, I think they were in the San Fernando Valley of Southern California, was Isolite. And I love Isolite. As a hygienist, like I know one hygienist was upset because their doctor said, you're going to have to scale with one hand and suction with the other. I mean, seriously, Stan, like I'm one of these hygienists, like I like to have an extra oral fulcrum. So in that situation, I could want to use two hands for my scaling. And so I think Isolite's a great solution. I'm sure Isolite's on top of this situation.
Yeah, Isolite is a wonderful product, and I'm sure it'll stay very popular. I was just curious if there might be cases where in the interim, maybe more hand scaling than ultrasonic scaling.
Oh,
are there? I was just curious if there, you know, I've heard some practices say they might, until they're a little more confident with this whole virus thing being under control, maybe change what they do in terms of some of these routine procedures.
I mean, there are going to be some patients. I mean, I learned when I was a student at USC, Anna Pattison was our program director, and she did not believe in ultrasonics way back 35 years ago. And now I've learned to use ultrasonics. Like I would say at least 50% of my patients, I do need to use it. And I think we're going to see a lot of patients who have heavy supra buildup. So that using the ultrasonic is going to zap that right off.
Sure.
So
I mean, it's a great method. I was just curious if some people might be, you know, shy away from it.
I'm sure they are, but I also think that, you know, the doctor has to be open to doing what's best for their team.
Yeah.
So they need to get the hygienist the best support, because whenever I'm doing a training, I always get everybody to agree with me from the very beginning that we're in the business of doing what's best for our patients, not what's cost effective for the practice or what the insurance pays for.
Yeah.
And if we're all in agreement on that, then we're going to use our PPP. I just talked to a doctor. She applied for her PPP loan. She didn't get it the first time, but she did get it. So you're going to need to use some of that money. Like Isolite, you can afford to get Isolite for your hygienist with that. And you're going to need to get some new Profi angle handpieces too, because, you know, most offices that I work in, they are not changing the sleeve on that handpiece, and it's going to need to be changed.
Yeah. And just advice for hygienists in general in practices talking about their hygiene departments. And what's the easiest way to? It's difficult to stay on top of all this. Things are changing all the time. There's what do you recommend hygienists and practices? How do they stay on top of all these changes?
Good question. So one of the first resources I went to was at epa.org, .gov.
Yeah.
E like Edgar, P like Paul, A like Apple, .gov. And you can scan a huge document of what disinfectants are acceptable to use. And that's very important moving forward, that you look at that list. Now, I will tell you on the list, I'll tell you want to look for the ones that are 30 seconds, no more than 2 minutes, that you can wipe down with, because they are available. Okay.
Gotcha.
That's super important. The other thing is I want you to always be looking at the cdc.gov. That's our Center for Disease Control. You also want to look at the ADA website and your state dental website.
Gotcha.
So you also have, like, I talked to my acupuncturist. I was really surprised. I wanted to see my acupuncturist this week, and he's not able to see me. But dental offices are open. Like, something is wrong with this picture. Not to get political, but the government is making decisions on who can be open for healthcare. Like, my acupuncturist can't be open till June. I don't know, Stan. I was really confused. In fact, I'm going to talk to him later because I'm like, are you sure you're not misreading this?
Well, there's confusion with dental practices from state to state and the guidelines and the suggestions, and that's why I threw that question out there. It's just I know the ADA had some recent guidelines, and I think I'm sure the ADHA did as well. It just stay informed the best you can, and then communicate that with your patients, and the doctors need to communicate it with their staff.
Yeah, it was like probably April 15th. I looked at the CDC on the N95 mask, and then I did something with Patterson. It was probably like the 15th or 20th of April. And then on May 1st, I'm thinking, okay, it was recent that I looked at that website. And on May 1st, I'm doing this webinar for Patterson Dental. And then the lady at Patterson said, oh, the CDC changed on April 29th. They changed that N95 masks are now mandatory for dental professionals.
Yeah. Well, speaking of that, I guess I'm sure there's probably hygienists that'll ask you to help them find their practice more masks. I mean, there's all these questions about, how important. Everyone knows the PPE is important, but what about the shortages, or where do you get it, or
Yeah. So email me. You can give them my email, Stan.
Sure.
Because I do have a doctor who can help you get that.
Gotcha.
Yeah, so he knows somebody who can get that for you ASAP. One of the things I think is really important is you've got to, when you decide to open, you have got to have enough supplies for at least 14 days. And then when you open, you constantly have to make sure you've got enough of these supplies in place. The other thing is people are asking me about disposable gowns versus the laundered ones. And for me, I do like the laundered ones. I would rather just have it in a closed laundry bag, and it's a basket that's a little closed, and somebody else deal with it. Now, some doctors are saying, well, I'm installing a washer and dryer, but I just don't want to handle that, and I don't want to have to pay, like, some disposable gowns are around $3 each. Yeah. So imagine how many times you're changing your gown. I think that can add up, and maybe it's $5 or $10 per person for the entire day to have it laundered. You got to look at the cost benefit ratio there, because I'm used to having a laundering service. Where I was a hygienist 15 years ago, we had a laundering service that came in. They took our towels, a lot of different things they laundered for us. And I just like that. I like that.
Gotcha. And one other thing very important going forward is just the pre-screening of patients and the changes in waiting rooms or patients sitting in parking lots. I mean, there's a lot to figure out, but you can't be too safe these days.
Exactly. So that's one of the things that we talk about on day 3 as well of that program you mentioned, but also, the doctors who are taking the time to schedule, just complimentary, because I'm on a mission to help as many dentists as possible. It's for 30 minutes I'll take, and we can actually coordinate how that's going to work with them.
Good. Good.
Each practice is different, and I don't have all the answers, but I have a lot of knowledge and I can help them. It's like a brainstorm, you know?
Wonderful. Well, I appreciate your time. You know what we could do is we could throw your website out there. So if anybody wanted to check out some of your newer courses or some of your
Oh,
webinars, what can you tell us that?
yes, it's dentalpracticesolutions.com. It's plural. I have many solutions, dentalpracticesolutions.com.
Great, great. Well, thank you very much for your time, Debbie. And I hope we can talk soon. And I hope when we do talk next that the virus is a little bit more under control and there's a little bit more happy
Oh,
news, and we can go forward and get this industry back strong and taking care of as many patients as possible.
I think we will. I think it'll be a different situation. I'm talking to people, my best friend in Florida, things have opened up.
Good, good, good. Well, thank you very much for your time, and we'll be in touch soon.
Okay, talk to you soon, Stan.
Thanks.
Bye.
Bye-bye.